So welcome everybody to tonight's session. We're glad you can join us and for jumping on. Um, this is the Works for Me Family Engagements training session. We're focused on for parents and family training during these sessions, things that maybe some of the things that concern us as parents, especially when our child is looking at employment or even changes in their life, depending on what those transition stages are, because we have transition, throughout their lives. So tonight we're going to learn about understanding SSI, SSDI, benefits and the incentives. And we're going to hear from two speakers tonight that are totally with the experience in these areas. And I'm going to let them to introduce themselves. For those who may be just joining, my name is Patty Schramm. I'm the family engagement trainer and family mentor. In the works for me, currently we have 3 family mentors. If you are seeking a family mentor if you're a provider and you want to reach out to the family mentor, you'd be reaching out to Gina, and I'll have her put her contact information in the chat box. So with that, I'm going to turn it over to Debbie Schwartz. She's one of our speakers, and Stephen. And I made both of you co-hosts, so I guess Stephen, you can share your screen if you'd like, and go ahead and introduce yourselves.
All right, thank you, Patty. My name is Stephen Seeberg. Good evening, everybody. I am a work incentives consultant with opportunities for Ohioans with disabilities, and I am dedicated entirely to the Works For Me program. So everybody I help is in this program all throughout the state.
Great. And my name is Debbie Schwartz. I worked for the Social Security Administration for 39 years before retiring 8 years ago and opening my own company so that I can focus on return to work issues for families directly. And I'm also the parent of 2 adult children with disabilities, so I bring that perspective as well.
All right, I am going to go ahead and share my screen so I can get this presentation going. I hope everybody can see it. Is that nice and big for everybody?
Mhm.
Yes, yes. And
Um,
everybody can hear the presentation okay, correct? I have one person that couldn't, but that might be their own system. Give me a thumbs up or just say, yes, I can hear.
Yes, I can hear.
Okay. All right. Thank you. Go ahead, Stephen and Debbie.
okay. So we will get started. There's us. Um, Nice to be here with everybody this evening. So we're going to start the presentation with a little roadmap here of what we're going to cover today. So we'll talk about the cash benefits that individuals may receive, either SSI, Supplemental Security Income, or SSDI, which is Social Security Disability Insurance, and some of the differences between those two programs. We'll also talk about the healthcare benefits that you may receive, Medicaid, Medicare, things of that nature. And we'll also briefly touch on how the benefit analysis process works with the Works For Me program. Spoiler alert, it's actually pretty simple on your end. So there's not a whole lot that you need to do to get signed up to do one of these with me, okay? And with that, we'll start with some common myths that we hear a lot that people are concerned about. There is unfortunately a lot of misinformation in the community about what may or may not happen to someone's benefits if they begin working. So the big one, of course, the first one, if I start working, I'm going to lose my benefit check. It's going to be gone. Um, and that's not necessarily the case. If you stay under certain income limits, you can keep some or all of your benefit checks depending on the type. If you stay under your income limit, you can keep all of your SSDI check, and you'll be able to keep a portion of your SSI check staying under the income limits that we have right now. Myth number two, people are very concerned about their health care, and rightfully so. They're worried if they go to work, they'll lose access to their Medicaid or their Medicare. First and foremost, if you keep your benefit checks, you'll keep that coverage. It will not go anywhere. And even if you earn enough money that you do lose one or both of those cash benefits, there are programs in place that allow you to keep them. For Medicaid, it is indefinite. As long as your income stays under a limit, you can stay on Medicaid theoretically for 100 more years if you need to. And for Medicare, there is an extended period of Medicare coverage that lasts at least 7 more years after your check were to stop. So you can stay on health insurance, both of them, for a very long time. Lastly, I think people are concerned a lot that it's not worth their while to work. They're already getting a benefit check. It's more money that they get. They don't want to lose any of that check, and we understand that. Um, but it's not our job to, see you have less money coming in here either. We're trying to maximize what you're able to earn and keep benefits at the same time. Pretty much everyone that we work with has more money coming in overall when they work. And I'm sure, Debbie, you've got a lot of stories about people who come to you with some bad that straight.
Yeah, I have a lot of families who are very concerned. The myth number two, especially the Medicaid. They're very concerned about that health insurance piece. And, it's so reassuring to be able to tell them that they're not going to lose that Medicaid, that there, as we'll discuss later, plenty of ways to keep it. And as far as the myth number three, one of the things that in addition to they can maximize the benefit and still have those earnings, so they have earnings and the benefit, they're working and paying into Social Security, which is improving or increasing their potential retirement down the road. And also more immediate things like maybe the earned income tax credit, which is available to individuals with disabilities, and other things that may provide extra money that they weren't really thinking about when they're only thinking about that benefit check. And that's why the benefit analysis is so very important, so that they can work out what things are available to them, so that they make sure that they are taking advantage of everything that's possible for them.
Mhm. Absolutely. That's really the goal of this benefit analysis. Again, it's not our job to get you off the rolls per se. It's our job to say, hey, you can make X amount of dollars, keep this medical coverage, keep some of this check, so you're really in a better position overall for sure. So with that, we will start with SSI, okay, Supplemental Security Income, that cash program. It's based on financial need. There is a yearly maximum federal benefit rate. This year it is $994 a month. And of course, the more you make, the smaller your SSI check will become. However, it does not drop dollar for dollar. If you make $500 a month, you don't lose $500 from that check. Um, you get a $65 to $85 income exclusion that they do not count against you. And then after that, for every $2 you make, they only subtract $1 from that SSI check. So, as a quick example, if you made $585 in a month, they would exclude the first 85 and then only take out half of what's left. So, even if you made $585, you'd only lose $250 from your SSI check. So, more money comes in overall. So if you're on SSI, you literally always make more money by working versus not, right, Debbie?
Absolutely. And if you downloaded the printouts beforehand,
Mhm.
there is a worksheet that you can follow. It's two-sided. One side has SSDI on it, the other side SSI. And in addition to the screens and the PowerPoint screens, you can see some other additional visual work formulas with that $1 for every two on that sheet.
Yeah. Lots of tools for you here this evening. We want you to get a really good grasp of all this stuff going on.
Lots of cheat sheets,
That's
yes.
right. We need them. We're not taking a test on this. We can have them out whenever we need them.
Yes, sir.
Speaking of visuals, here's another one just to try to give you an example of what we talked about on the previous slide. So there on the left is when Robert's not working. He's getting his full SSI check, which is $994 a month this year in 2026. But then he finds a job out in the community, which is awesome. And he's working 15 hours a week at about $14 an hour. That equals $909 a month in gross wages. Taxes aren't taken out yet or anything of that nature. But you can see what that results in over here. Yes, his SSI check is lower, but that is clearly a lot more income coming in overall than just staying on SSI and not getting out and working in the community. And if you're wondering how much, don't worry, we did the math for you. That's $497 more in a month, which is almost $6,000 more income per year working versus not working on SSI in this scenario.
And don't forget, you do not lose your Medicaid with that as well. So not only do you have the extra income, but you also get to keep that Medicaid coverage.
That's right. Even if your SSI check is $1 a month, you still get SSI Medicaid. That's right. Now, one of the things we always like to, I always check in about this when I do a benefits analysis is wage reporting. Um, Always report, always report, always report. There's really no other way to say that. They would like you to report your previous month's income by the 6th of next month, and you have lots of options. You can go to login.gov and create what's called a My SSA account, and you can enter your information there. For SSI only, there is also a mobile wage reporting app. You can download it on your phone. It's a free app, and you can report your wages there. Some people like to do it old school. Maybe a representative payee does this for you as well in some cases, but they like to mail physical pay stubs in, which is an option as well. You may not get a receipt if you mail them in. You can drop them off directly at the Social Security office, and they will give you a receipt if you want to keep those for your records so that if there's any discrepancies at any point in time, you would have a record of all those earnings that you've had. Okay. We like reporting our wages, right, Debbie?
We absolutely do.
Mhm.
And Social Security really does make it easy, either using the mobile app or the online app, or even with SSI, there's a telephone app that you can use.
Hmm,
And any of those are very good and provide a receipt proving you reported the wages fairly quickly.
that's good. Also, with individuals who are working with these providers, there are some providers that do report wages directly. Not all, but some. I know Ohio Valley Goodwill is an example down in Cincinnati will do that for some individuals. Um, and then if they get a job out in the community, all of a sudden they're not working at Goodwill anymore. And so their wages aren't being reported, and sometimes issues can happen that way. So if an individual is gonna change jobs and they're gonna be out in the community, it's good to have a plan to make sure, oh, that's right, Goodwill won't be reporting wages if someone's working at Giant Eagle now. So we need to make sure that we have a plan to get those wages reported to Social Security. Okay. Always, always a good idea. Yeah. It's there in bold and red, just so you remember. Always try to report those wages to do your best to avoid a potential overpayment from Social Security. Now, as far as health insurance is concerned relative to SSI, it is Medicaid coverage that is attached to an SSI check. Okay. So there are several levels of Medicaid coverage that are available to individuals based on earnings. So the first one is SSI Medicaid. As you know, if you get an SSI check, you get Medicaid coverage with it. The next step is 1619B Medicaid. That's essentially continuation of your SSI coverage for individuals who earn too much money and they go over an SSI limit to where their check becomes reduced to zero. That sounds very scary, but an individual not only has more money coming in at that point, but they're able to stay on what is essentially the same Medicaid coverage just by a different name. And lastly, this program has been very important for a lot of individuals. Oops, didn't want to click there. MBIWD, or Medicaid Buy-in for Workers with Disabilities. There are a lot of advantages to signing up for this program. Even if someone is only working 5 hours a week, they qualify for MBIWD. Um, it greatly increases your asset limit from $2,000 to over $15,000. And it also eliminates any share of cost with any Medicaid waivers that individual may have. These HCBS or home and community based service. Waivers provide a lot of extra services like transportation, home health care, home modifications that regular Medicaid doesn't provide. And the MBIWD program can actually eliminate any share of cost if your income gets higher on those Medicaid waivers. That's all right, Debbie, right? Feel free to check me on that.
Yes, yes, yes. I was just doing the math. This year it's 2,982 before you hit your personal um income limit on the Medicaid waiver. And so if you're earning more than that, you found the perfect job by utilizing
Right.
the Medicaid waiver instead of having a patient liability of anything dollar for dollar over
Mhm.
that 2,982. It would actually, you may have a small premium for Medicaid buy-in, maybe none at all with all the disregards. And that way you get to keep your earnings and have your Medicaid
Mhm.
as well, and maintain your waiver services, which I know for my son are very, very important as he transports him to and from work and
Mhm.
takes him out places so that he doesn't have to hang with mom all the time. So, I mean, that's very important that they be able to maintain those services.
Yeah, I agree. And just to try to put what we talked about there in another visual for people, we've got a little staircase for you here. So, for SSI Medicaid, if you have no other source of income, if you don't also have an SSDI benefit check or something of that nature, you can earn up to $2,072 a month this year here in 2026 and stay on SSI, which means you keep your SSI Medicaid. If you do earn more than that, or you have more than that coming in, maybe you're making $1,500 a month and you've got, $1,000 SSDI check, something like that nature. As long as it's the earned income that puts you over, you then qualify for that 1619B Medicaid continuation that we spoke of. The annual income limit is much higher. It's 50,138 this year, which quick math tells me that's over $4,000 in earned income a month, which
Mhm.
honestly, I'd like to make that if we're being totally real here. So that's a nice high income limit for a lot of individuals. And then lastly is that MBIWD program. Debbie, you spoke briefly about the earned income disregard. They will disregard $20,000 per year of earned income. So that puts the annual income limit for MBIWD around $58,000 this year, if I'm not mistaken. Is that right?
Yeah,
Yeah.
yeah. So again, you can feel blessed being able to, if you find that perfect job, you can take that job, have
Mm.
that money, and not lose your safety net of benefits, which I think is spectacular.
Yeah. There are a lot I know you have a ton more experience with this than I do, Debbie. You've been doing this a long time. I think the medical coverage might even be more important for a lot of people than worrying about losing the cash benefit. Is there any time where that really hit home for someone that they were able to keep everything?
You know, I do a lot of transitional youth, so I'm dealing with students that are maybe starting off looking into this at 16, 17, and maybe they're aging out of the school system. They're going to stay in deferred diploma until 22,
Mhm.
and mom and dad are really worried about them, because they have the benefits and they have that Medicaid, and maybe they have a $3,000 medication that they certainly cannot afford, where they might have a great job, but if they had to pay for that prescription, it would not be advantageous for them to work. And the relief when they get that comfort of knowing, okay, the SSI cash check may go down, but they're going to have 1619B. And then if they really go gangbusters and make a lot of money, they can do the Medicaid buy-in for workers with disabilities. I have had parents who were reluctant to allow their student to participate in work study programs
Mm.
get on board and be very excited about it. So I think the medical component of this is so much almost more important, I think, a lot of times than the cash benefit,
Yeah,
because they'll have
I
the
agree.
wages for the cash. It's that health insurance or that one prescription or that one medical treatment that they need that is so expensive that they couldn't possibly cover it without having that insurance. And this takes care of it, or they're on a waiver. And those waiver services are so critical,
That's right.
and you don't want to lose that waiver. And these programs allow parents to be able to make good decisions for their adult children, that help them into the future, but aren't messing with their current life.
Absolutely. And there are some extra benefits as well that we don't have on here that Debbie can speak to. The one that comes to mind with the transitional youth is the student earned income exclusion.
Yeah, the student earned income exclusion is really great. Whenever I'm dealing with a parent, especially who's deciding whether or not to allow their student to defer diploma and maybe do Project Life or Project Search or Career X, and they're trying to figure out what what they can do. They can make over 2,000 a month,
Mhm.
up to over 9,000 a year, and still draw their SSI check. So it's not the 65 plus 20 divided by 2, anything over that. The disregards are much more significant. And the reason for that is they want to give students that incentive to want to go to work. And Patty's heard the story before. Um, when my son, who's neurodivergent and on the spectrum, was 16, we were helping out a friend at work, and he owned a restaurant, and he didn't make enough to hire a bunch of staff, but he had too much for one item that he didn't, or one night that he wasn't going to be able to staff it all completely. So my son, who would get bored, sometimes when we would go to the restaurant, would help bus tables and things. And so Tony asked him if he would be willing to do that for this special Christmas party. And so we said yes. And I told him afterwards, because I was going to help waitress. And I told my son, I said, look, I know Tony can't afford to pay you probably, but I'll give you half of anything I earned. And I'm sure these people will be kind to me. And so when we got out in the car, after longest 4 hours of my life working, I gave Andrew half of what I had made in tips. And he added it to a wad of money that he had. And I said, where'd you get that? And he said, well, Tony paid me. And in the 20 minutes it took us to drive home, he called no less than 6 or 7 of his friends. When you're not going to believe this, I have $85, and all I had to do was just wash some stupid dishes and clear some plate. Are you kidding me? And he was so excited he had made that much money. Now, there's always a day to learn, teach your child how to learn to save. But that next day, I let him go blow the whole thing at Best Buy on DVDs and movies and video games and everything else, because I wanted him to get that link that work was good. And when you work, good things can come from it. And now that he's 35 and working out in the community, he'll let you know, I don't want to miss a day of work. I like to be able to get that extra money. I like going to the movies. I like doing these other things. I like being part of my community. So getting that student earned income exclusion really helps that transition youth get that excitement about earning money without having to even lose the cash benefit. So mom and dad are more willing to let them try. And it's such a great way to get them work experience and let them try different things. Funny enough, my son is a dishwasher in a nursing home now. So that little one night job came in handy later. But it's making those connections and helping connect those dots that they get to understand that that work and those earnings, there's personal satisfaction, and there's excitement, but then equating the I have extra money, ergo I can do extra things.
Mhm.
And so the student earning income exclusion is probably one of my favorite work incentive, especially for the transition youth.
Absolutely. And I can tell you from the Works for Me perspective, we are actually amending the contracts with providers to allow Works for Me services to be provided to youth and individuals in that stage. So it's something that'll be available to anyone who's going through that phase right now, which is great.
Wonderful.
Um, I will pause for just a second here, Patty. Are there any like super duper pressing SSI and or Medicaid questions? We might be able to answer one or two before we continue on.
Not at this point. There isn't any questions. But
Okay.
I've asked them to put it in the chat box and we'll address them as we go.
Sounds good. Thank you, Patty.
Or at the end. So either
Either
one.
or. Yeah.
Hmm.
All right. Well, with that, we will head on to cash benefit program number two, SSDI, or Social Security Disability Insurance. That program also contains what we call CDB or Childhood Disability Benefit checks as well, generally drawn on like a parent's work record who has like retired in all likelihood. Okay. These are based on a work record. So if someone, even if you've been working in sub-minimum wage, if you've been doing it for a decade or so or more, you may have earned enough money, enough work credits that you qualify for a disability insurance check on your own work record. Or if an individual, a parent has retired and is drawing Social Security, you may qualify with a CDB check as well. That amount stays the same. It will change once a year with cost of living adjustment, but that check does not fluctuate month after month based on earnings, like your SSI check may. It stays the same each month. And there are several incentives tied to the SSDI or CDB program that allow you to try working out for a while to see how much you're able to do, how much you're able to work in the community, how much you can make while you keep your benefits in the meantime, so that you don't worry about making, a good amount of money one month and then losing all your benefits right away. So they've structured it pretty well to give you a good shot at working out in the community to see how much you're able to earn on a consistent basis, which is really helpful. All right. So here comes a visual. We're going to fill this in little by little here. So once you are deemed eligible for an SSDI or a CDB benefit, the first incentive available to you is known as the trial work period. This year in 2026, the threshold to trigger a trial work month is $1,210 a month in earnings. To give you an idea, that's roughly 20 hours a week at $14 an hour. That's about what gets you to $1,210 in a month. Okay. You get 9 trial work months, and doesn't have to be consecutive. It has to be 9 months in any rolling 60-month or 5-year period. So if you use two or three of them, in 2026, and then you take a few months off if there's health issues or whatever, and then you use the rest of them in 2027 or 2028, that would still count because that would be within a 5-year time frame. But during the trial work period, it does not matter how much money you earn. You keep that benefit check. I like to say this, it gets people chuckling. Theoretically, you could make $1 million a month and keep your benefit check for those 9 months. It's giving you a chance to try out working to see how much money you can make, right, Debbie?
Yes, absolutely.
So you get those 9 months. Let's say you've burned all of those months. You've earned over $1,210. After your ninth month, you enter what we call the EPE, is the extended period of eligibility. This is a 3 month period straight through 36 or 3 year, excuse me, 36 month consecutive period. I misspoke. My apologies. Um, at this point now, the number that becomes more important is what we call the substantial gainful activity level, or SGA. There's a whole lot of acronyms. It's very much alphabet soup around here. That number this year is right here. It is $1,690 a month. Okay. So if you were to make over $1,690 a month during the EPE, you would not get your benefit check that month. However, if you earned less than that a month later, 2 months later, 5 months later, as long as you're within the EPE, you simply call Social Security, say, hey, I dropped back under SGA, and your SSDI benefit check restarts the very next month. Okay. So you don't have to do an application. You don't have to mess with any of that. You're considered suspended, but not terminated yet. So during that 3 years, you can restart your benefits with a phone call. So it's a pretty simple process still. After that, after your 36 months in the EPE, is essentially when your benefits may terminate. So after the EPE ends, if you earn over $1,690 in a month, again, now that number will be higher by then because it'll be 3 years down the road. If you earn over SGA in a month, your benefit will terminate. But there is still another avenue where you can restart your benefits a little bit easier than doing a whole new application. That avenue is known as expedited reinstatement. So if there's some sort of hardship, you're unable to sustain working above that SGA level, if it's within 5 years of the end of your EPE, you are able to apply for expedited reinstatement. It is an abbreviated application. It's not the full process, and likely get your benefits restarted. Okay.
Can I insert something there?
Yeah, absolutely.
Great, thanks. The great thing about the expedited reinstatement, and this is a question that I receive a lot, is okay, I'm doing great, and I don't care about my cash benefit terminating, but then it stops. And then I've got to wait while they make a new decision. How am I going to eat or how am I going to live while they make a new decision? With the expedited reinstatement, they will actually pay you your SSDI benefit for up to 6 months while they make that medical decision
Yep.
and reinstate your Medicare in the event that somehow you would even work beyond the Medicare. So, I mean, to me, it's just a perfect way of saying you're protected no matter what. Even if you work your way completely off benefits, this will give you that check back. So you're not having to worry about how am I going to eat for those 5 or 6 months while they make a new medical decision.
hmm That is right. Um, Provisional benefits, is that what they call them while they're,
Yes.
yeah, that's what they call them while they're making their new decision. So Debbie's absolutely right. That's very helpful in the meantime while you wait for that new decision. So just some takeaways from that big chart there. During the trial work period, you can earn as much as you want. You keep your benefit check for any and all of those 9 months. After the trial work period, as long as you stay under SGA, you still keep your check. If you go over it during the EPE, you will lose it, but you can restart them with a phone call. After the EPE, then you would eventually be terminated. But again, if something does happen, there is that expedited reinstatement avenue for 5 years further. Okay. It's probably clear as mud, right? Any other any other thoughts about the TWP and all of these benefits?
No, I think they're actually pretty straightforward. It's pretty linear. I think the biggest takeaway is that no matter what, if you're working and you're working at your best potential, after a while you may lose the cash benefit, but there's always a way to always is a way to get it back.
Mhm.
And so you should never let that stop you from trying to do the most that you can while you can.
Absolutely. Yeah, and I think we didn't address this as one of the myths at the start of this presentation, but I do think some people approach the process with a sense of trepidation that everybody is just trying to get people off all the benefits as fast as possible, and that's not. I'm sure that's not what you do, Debbie. It's not what we do at OOD. Um,
Absolutely not.
yeah, it's our goal to help you maximize your earnings and in conjunction with your benefits, keep as many of them as you can for as long as you can.
understanding that there are always safety nets. I think that's the thing. Even if, okay, trial work period is over, we pull that safety net away, you still have several underneath. You're never going to hit the concrete floor. And sometimes people are so frightened that they're going to be without, and being able to understand the work incentives and knowing how they apply to you personally, so you know how to take advantage of them to your best advantage, and knowing that you're never going to be left alone, I think is very important, because some people have cyclical disabilities or illnesses. Sometimes you feel better for a while and then you're not so better for a while. And to know that there's a program that rolls with the punches right along with you, I think is very comforting, to know that you're not out there by yourself.
I totally agree. And there are even more tools, again, that aren't on this PowerPoint that are probably on Debbie's cheat sheet for you. With respect to SSDI, I'm thinking of IRWIs, subsidies or special conditions. What can you tell us about those?
Are we in special conditions when they're looking? You mentioned that alphabet soup, SGA, substantial gainful activity. What they're looking at is, do you have the ability to work at a substantial level, independently, and to be able to carry that for at least 12 consecutive months? But Social Security is aware that sometimes you may have a benevolent employer, or you may have extra out of pocket expenses. And they want to level the playing field between a person with a disability and a person without a disability. So you're right. On my cheat sheet, I do have impairment related work expenses as one of the two that's really important. And that would be if you have an out of pocket medical expense that you're having to pay for out of pocket in order to be able to conduct that employment. Even if your earnings are over $1,690 a month, you could subtract off those out of pocket expenses that are extraordinary to you, but not to a non impaired disability person, and still maybe be able to maintain that SSDI benefit. So that could be co-payments for doctors. I know a lot of times people have physical therapy or mental health services that are not covered by insurance, and they have to pay those out of pocket in order to maintain their health. Sometimes an individual, because of their disability, can't drive and cannot access public transportation. So they may have to pay an Uber, or a taxi cab to get to and from work. And so those would be extraordinary expenses that could be subtracted. Or under the subsidy and special conditions, we're looking at, maybe an individual without a disability has to bring in 100 carts an hour from the parking lot at Kroger, but an individual with a disability who gets paid the same amount of money because of their disability can only bring in 75 carts an hour. They could document that. There's forms for that through Social Security. And they could document to say, well, they're doing about 25% less, but we love him. He shows up every day. He does everything else we ask. So if he's doing, 25% less, we're good with that. They would adjust the gross wages to accommodate that extra support that they're getting from that employer. So if they were making $2,000 a month, but had a 20% subsidy, we'd take $400, which is 20% of 2,000, and only count 1,600. So instead of being above SGA, they're now below SGA. So those are, again, things that you'd want to talk about, when getting your benefit analysis report, to kind of explore to see if any of those things are going to be options for you, so that you're aware of those, because Social Security needs to be aware of those in order for them to make the proper decision. But those are ways that you can earn even above the $1,690 and still draw that SSDI check after the 9-month trial work period.
It's absolutely right. And all of that information will always be included on your work incentive reports that I will draw up if you do receive an SSDI or a CDB benefit. We put all that information there at your perusal. You may not need it for a month or 6 months, but it will always be ready for you when it's time to get looking out in the community.
Absolutely.
Now, as far as healthcare is concerned, the healthcare that is tied to your SSDI or CDB benefit is Medicare. Um, After a 2-year waiting period, your Part A coverage is free with an SSDI or CDB check. That's your hospital coverage. Part B, the premiums keep going up and up and up. It's almost $203 here in 2026. There are several programs, Medicare savings programs, that can pay that Part B premium. And in some cases, if you're on the all-inclusive package that's known as QMB or Qualified Medicare Beneficiary, that program also pays any deductibles, any co-payments for doctor visits, things of that nature. So there are lots of ways to have some, if not all, of your Medicare costs covered, which is really nice. And again, all that will be drawn up for you on a work incentives report, so you can sort of make your best guess at how much you can earn and stay on a certain program and have lots of your Medicare costs covered. Does that all sound right, Debbie?
It does. Absolutely.
All right. We will pause again briefly here. Are there any pressing questions in this section or in general, Patty? We can hit one or two if you want.
Not at this time. I did share the link to the Debbie's handouts since you're referring to them.
Yeah.
You can click on that link, and I earlier, and I'll share it again, the link to this presentation too, so you can get to all the information when you're ready to review it again. But no questions at this time.
Well, Debbie, I think we're doing better than I thought we were gonna. If no one's got any questions for
Yeah,
40 minutes in, that's pretty good.
we're we've got a few screens left.
Yeah, I may have
We're
jinxed
good.
it.
We're good.
If I jinxed it, I apologize on our behalf.
No, you're
Yeah.
okay.
All right. So again, a big takeaway thread here. First of all, with SSI, just the way that program is structured, you will always have more money by working on SSI than by not working. Plain and simple. They take far less out of your check than you earn. They don't subtract dollar for dollar. You get exclusions, you get things of that nature. So it's always beneficial financially to work on SSI. As far as SSDI or CDB is concerned, again, the biggest number is that SGA, that substantial gainful activity level. As long as you make under $1,690 a month, you keep that check. And if you keep that check, that means you also keep your free Medicare Part A after the 2-year waiting period. Just like with SSI, as long as you have that check, you got SSI Medicaid. So your health insurance stays the same, cash benefit stays as well. And I harp on this a lot. I know I already did once. I'm gonna do it again. Report, report, report. Always report. There are people out there that say, "Oh, it's SSDI. Your check doesn't change. You don't need to report your income." I respectfully and vehemently disagree. Always report that income.
And I would agree with that. And I know sometimes keeping paperwork is it can be challenging. But if you've had a benefit report done by either OOD or an independent person like myself, there's a chart that shows, basically where you can start trying to keep track of the trial work period months and so forth. When you've used, reporting every month, and the online application for SSDI is exceptional for that, it becomes a repository for the information. But that computer does not automatically then convert that into the 9-month trial work period and the 36-month extended period of eligibility independently. You're going to still need to be in touch with Social Security to say, I think my 9-month trial work period is about up. Can you run that? Can you do that review to calculate it so I know where I am? Just to make sure, because otherwise what happens is they catch up with it, but a year or two later. and we don't want anything to happen. And so, in addition to him saying report, 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 I always encourage be proactive, be proactive, be proactive. Be your own best advocate in helping count those trial work period months. If you need to go back to the person who did your report and say, okay, here's where I think I am. Can you tell me if I'm for sure? Because I don't think Social Security calculated it right. Double check, because you want to stay on top of that. You don't want it to get away from you. And being proactive, reporting right away and being proactive and monitoring that is very, very important in making sure the benefits start and stop and start back up again, realistically. Because if you aren't reporting and you hadn't been drawing a check for a while, and now all of a sudden you need your benefit back right away, they're going to make you go back to the last time you reported wages. So if you were faithful about reporting every month and you were proactive in keeping track of when they should start and stop, it'll be easy peasy to get that benefit back if you need it.
Yeah. Yeah, it's and Debbie, you can probably speak to this better than I can, but my understanding is that the SSI and SSDI systems at Social Security don't always converse. Is that right?
That is absolutely true. If you report on the SSI wage reporting program, whether you're using the mobile app or the online system or the telephone wage reporting system, the SSI will automatically issue the receipt and it will adjust the benefits accordingly. That's great for SSI, but that does not talk to SSDI. And understand, and this gets kind of in the weeds of it, but SSI counts it when you get the check. SSDI is when you earn the money. So they're not necessarily counting from the same pot of money. It's distributed differently. That's why it's so important. The online application says, what's the pay date? What was the pay period beginning date? What was the pay period ending date? What was the gross amount? And that way they're able to proportion it out whichever way they need to, depending upon the program. SSI, boy, they're lickety split. They're on top of it. Their computer can automatically convert that next month's check. SSDI, it just becomes a repository for the information, and then it takes human intervention to go in, download those earnings, and run a report. And that's why you have to be a little more proactive with Social Security to say, hey, I think it's time you run one of those reports for me.
Yeah. And obviously, Debbie, you got a ton more experience in this arena than I do, but from my perspective, one of the times to be especially vigilant is when it is a CDB benefit, because that is based on somebody else's social security number, not the individual. And just I hadn't been doing this very long. One of the first reports I did, an individual had already served his 2-year waiting period and was 5 months past it and had not yet gotten his Medicare Part A coverage, because it was on a parent's work record and the processing center, the regional processing center, had missed it. So I spent a lot of time on the phone with Social Security over several weeks trying to explain, yes, I understand it's not his work record, it's a parent's work record. He is entitled to this Medicare Part A, and it took the better part of 2 months to get that sort of hashed out on their end.
It can take some time. When the computers work well, they work well. When there is a glitch, heaven help us, it could take some time. That's a lot of what I do in my current private practices, help individuals. I do a lot of work with county DD boards and OOD to help with those glitches and those reports to make sure we get those taken care of. But they can sometimes be a problem.
Yeah. Yep.
But they're doing the best they can. They
They
have
are.
half the staff. They have half the staff that they had 10 years ago, and twice as much work. So they're doing a really good job considering everything they have to deal with.
I agree. Do more with less. That's where we are these days.
Mm-hmm.
Um, so I just want to briefly touch on how the process works in the Works For Me program with respect to getting a benefits analysis. Okay. So what would happen is we would set up a meeting with either an OOD counselor in your area or perhaps a caseload assistant, depending on who is assigned to that specific provider where the individual is working. And you would need to sign releases at that point for me to get information from your local Social Security office as well as county job and family services, and also occasionally a housing authority if someone is receiving a housing voucher. And that's it. It is a simplified process. Generally, with OOD, you would have to do a full intake, be deemed eligible, do the whole rigmarole before you were eligible to receive a work incentives report. And that is not the case with Works for Me. We want to try and remove as many of those barriers to employment as we can up front, get them out of the way. So you can get a work incentives report done through me without doing a full case at OOD. Okay. I hassle Job and Family Services and Social Security until I get your information, and then I write up your report. We set up a meeting with you, your parents, your guardians, your SSA. Oftentimes, a representative from the provider likes to be there, which we like to see. Rep payees join, OD counselors join. Whomever you decide is important to be at that meeting is totally fine. And we do the meeting. I present the information, you get the report, and I'm always available. My phone number, email will be on every report if questions pop up later on, which they do. And like I said, that's it. You don't have to go through the entire OOD process. We hope you do when you join Works for Me. We hope you want to be deemed eligible and go through the work skills classes and job skills and development, things of that nature. But you don't have to for this portion of it. We want you to have the information as quickly as we can get it to you so that you can make an informed decision. Okay. And this is my favorite part of the reports that I do. So I just want to give you a sample of what it'll look like, one of the tools that will be in that report for you. This is essentially comparing sample scenarios for an individual. Okay, so it looks like this individual is looking to work between 15 and 20 hours a week out in the community, earning anywhere from $11 an hour, which is Ohio's state minimum wage in 2026, up to $14 an hour. And as you can see, this individual, that would be their sample job wages in this row right here. Here's their SSDI check. Looks like they're getting a little more than $1,000 a month in SSDI. And you can see how things change with Medicare coverage, Medicaid coverage. So this individual is on Medicare Part A for free with the SSDI check. They're on what we call a Slim B program, that's specified low income Medicare beneficiary. And that's paying Part B premiums for this person. But then all the way over here at the right, that program changes. Notice they're still getting their premiums covered by Part B, but it's a different program now. It's Medicare buy-in at that income level. Similar with Medicaid coverage, this individual has an IO Medicaid waiver. That's an individual options waiver. Looks like it's free of charge here at these first two levels. At these second two levels, they would start to be charged a monthly share of cost for that waiver unless they sign up for MBIWD, that Medicaid buy-in for workers with disabilities program we talked about in the Medicaid section a little bit earlier. That would eliminate the share of cost for the waiver and keep the Medicaid coverage free of charge as well. And as you can see, if someone were to, for some reason, choose not to enroll in that, the waivers can get expensive pretty quickly because, as Debbie mentioned, it is a dollar for dollar cost over the threshold. So if this person were to be earning $2,253 a month, all told, between their earnings and SSDI check, that's a lot of money, but they'd be charged $302 a month for that waiver unless they signed up for MBIWD, and then it's free. So that just gives you an example of how all of those scenarios would break down for this one individual, and everybody who does a work incentives report gets this individualized chart with me. And I like to put the green on the far right because that's the most money. We like the greenbacks, so that's where the green information goes. Anything to add, Debbie?
No, I don't think so. I think it's a good way of showing the graph. The only thing that I questioned was the Medicaid waiver. I think they can make 3 times the federal benefit rate. So
That's
I,
before they would lose it. That's correct.
yeah,
But at
okay.
that number, they would start to be charged. It's
2090.
1951 a month, yeah, for this year. And that number changes in March every year. All the rest of the numbers come out for January. I don't know why that one's in March, but we'll get it pretty soon here.
Yeah.
That number will go up a little bit as well. And Patty, I think that is just about everything we have. Debbie, any last minute thoughts or ideas?
No, I'm sure Patty's sharing our contact information
Hmm.
so that if anybody wants to that doesn't think about a question tonight wants to send a question later on, they'll know how to get in touch with one of us in order to make
Absolutely.
sure that they're not stuck out there.
So I'm going to, this is the time we are going to stop the recording and open it up for questions because I know several times, me as well, you don't want to ask questions during the recording or, you might have something specific you want to ask. So I'm going to stop the recording at this time. I want to thank Stephen and Debbie for presenting, for all the information you shared. And we're going to open it up then for questions. 1 second.